Our work is a clinical pathology case about osteoporosis. It's made by Elisa, Francisca, Manuela, Renata, and Tainá, students of physical therapy in the Federal University of Health Science of Porto Alegre, and it's oriented by Professor Dr. Pedro Aleixo. Our case presentation is about a 73-year-old woman presenting for a physical examination. She has a history of low trauma close fracture 11 years ago, which is a very common extra-articular fracture of the distal radius that occurs as the result of a fall onto an outstretched hand. She has no estrogen repulsion therapy, no prescription medications, takes a multivitamin daily plus a calcium tablet, and looks and feels healthy and well.
Here's the definition of osteoporosis, which is an acquired condition characterized by reduced bone mass, leading to bone fragility and susceptibility to fractures. The bone loss may be confined to certain bones or regions, as in this use osteoporosis of a limb, or be generalized, involving the entire skeleton. In both men and women, beginning in the third or fourth decade of life, bone resorption begins to outpace bone formation. The amount of bone loss with each cycle of remodeling is accelerated after menopause. Hence, the vulnerability of women to osteoporosis and its complications. Regardless of the underlying cause, the progressive loss of bone mass is clinically significant because of the resultant increase in the risk of fractures. We have primary and secondary osteoporosis. The primary is the most common form of osteoporosis and may be associated with aging, senile osteoporosis, or the postmenopausal state in women. The secondary is a consequence of inflammatory processes as rheumatoid arthritis, endocrine alterations as hyperthyroidism and adrenal disorders, multiple myeloma, disuse, use of drugs as heparin, alcohol, vitamin A, and corticoids.
Primary osteoporosis has two types. Type 1, or postmenopausal, is when bone loss occurs quickly and soon after menopause. Predominantly, it is observed in the trabecular bone and is associated to vertebral and radial distal fractures. Type 2, or senile, is related to aging and occurs due to chronic calcium deficiency, increased hormonal activities, and reduction in bone formation. Here we have an image to illustrate the trabecular and cortical part of the bone. As said earlier, the type 1 is associated with predominant trabecular loss and type 2 with cortical bone loss.
The risk factors include a drop in estrogen following menopause, metabolic diseases, vitamin deficiencies, aging factors that rely on genetic, nutritional, and environmental factors, as bad nutrition, early menopause, sedentarism, endocrinopathy, and others. The risk of osteoporosis with aging is related to the peak bone mass earlier in life. The greater the peak bone mass, the greater the delay in onset of osteoporosis. And here we can see that men have a greater peak comparing to women. In addition, women loses more bone density due to menopause.
Here it is a mental map to underline everything said before, the pathophysiology of postmenopausal and senile osteoporosis. So, we have genetic factor, physical activities, and nutrition as things that can change the peak in bone mass. In the left, we have type 1 osteoporosis, due to increase in estrogen and some important interleukins. In the right, we have type 2 osteoporosis, due to aging and characterized by the decrease in replicative bone activity and increase in bone synthesis.
The dynamic balance between bone formation by osteoblasts and bone resorption by osteoclasts tilts in favor of resorption. Several factors may tip the scales, as age-related changes when the matrix production activities of osteoblasts progressively diminish, and the various growth factors deposited in the extracellular matrix also diminish with time. Unfortunately, while new bone synthesis wanes with advancing age, osteoclasts retain their youthful vigor. Physical activity is important because the mechanical forces stimulate bone remodeling, and reduced physical activity increases bone loss. The genetic factors because the vitamin D receptor polymorphisms appear to influence the bone mass peak early in life. Additional genetic variables can influence either calcium uptake or PTH synthesis and responses. The deficiency of calcium occurs during a period of rapid bone growth. As a result, girls typically don't achieve the peak bone mass that could be otherwise expected and are accordingly more likely to develop clinically significant osteoporosis at an earlier age than their male counterparts.
This image shows a macroscopic image of an osteoporotic bone in the right and a normal one in the left. The osteoporotic vertebra exhibits a characteristic loss of horizontal trabecula and thickened vertical trabecula.
Almost all fractures in elderly people are partially due to low bone density. It is most prominent in areas containing abundant trabecular bone, namely the spine and femoral neck, though any bone is susceptible to fractures. The clinical diagnosis is based on the history of the patient, physical examination, and tests. It is difficult to diagnose because it's asymptomatic. It cannot be reliably detected in plain radiographs until 30 to 40% of bone mass has already disappeared. Serum levels of calcium, phosphorus, and alkaline phosphatides are notoriously insensitive.
The differential diagnosis is made with the bone densitometry DXA, which uses a very small dose of ionizing radiation to produce pictures of the inside of the body to measure bone loss. It is simple, quick, and non-invasive, and it's a standard method for diagnosis. It determines how much bone mass you actually have, and it's used to differentiate from osteomalacia, which can present in a very similar way but would be due to vitamin D deficiency. Talking about histological diagnosis, we can see that the cortices are thinned with dilated haversian canals, and trabecula are reduced in thickness and lose their interconnections. In the left, we have a normal bone, and in the right, an osteoporotic bone.
And another macroscopical picture of the osteoporotic bone, seeing a lower bone density in the most right image. These are our references, and thank you so much. Bye.